This is going to be some very plain talk about blepharoplasty, which is commonly known as eyelid lift surgery or treatment for eyelid bags. Eyelid bags, which are the lower eyelid bulges, make people look like they're sleepy or they have allergies. Everyone asks you, why are you so tired? It's really obvious in situations where you have overhead lighting, especially with video conferencing, which now everyone is doing. If you're wearing masks all the time, like everyone is in 2020 and beyond, then the only thing that anyone can see of you is your eyes. So it draws a lot of unwanted attention. A lot of this video is going to end up being kind of close up so that you can see exactly what I'm talking about on my own face, and I think it's very instructive as to what the actual problems are when people have eyelid bags and eyelid hooding, extra eyelid skin, and even forehead wrinkles, which in many cases are due to the upper eyelid extra skin and heaviness that people have. You can see on the forehead all of my wrinkles that I'm starting to get. When I raise my eyebrows, I'm really doing it because of that heaviness of my upper eyelid skin. So when I read, or if I'm trying to talk to somebody, I sort of reflexively do this so that I feel like my eyes are more open. I'm not really thinking about that, but that's what ends up happening. That is the only reason that people get those forehead wrinkles. So we're usually using Botox to make those go away, and obviously that's going to work, but that works because it's weakening that muscle and keeping us from doing that. If you don't have that eyelid heaviness, then you'll stop doing that. And most patients will find that when you get rid of that extra skin, they just kind of go away, and they actually don't need Botox or need much less than they did before that. So what you're doing is what I talk to people about all the time. You're kind of masking a problem by fixing one thing instead of actually correcting what is causing all of the problems. And that's when you can make things look the way they're really supposed to, instead of kind of fixing one little part of it and not getting the full result that you're actually after. Upper eyelid blepharoplasty is the surgery that's done to correct that upper eyelid skin, which again can be done wide awake with local anesthesia right here in the office. And that is to correct all of that extra skin. And you probably didn't notice how much extra there was when I was just looking straight ahead like this. Now that incision, to get rid of that, ends up being on the lower end of that extra skin, which is right in the fold, in the back of that crease. So that incision is fully hidden. When it heals, you can't tell that it's there. Nobody's going to notice that there's something there. The other part of that procedure is correcting what most people have, which is that little bulge that's right there on the center of the upper eyelid. And you can see it a little bit better here on this side since I didn't draw all over it. But fixing those two things makes that upper eyelid look really smooth, and it ends up looking terrific. Once you have a blepharoplasty to take care of that extra skin, that solves the problem, and it's a one-time procedure. So that's much more cost-effective than doing Botox multiple times. Lower eyelid crepey skin and extra skin and eyelid bags are caused by aging, and that's because the skin becomes thinner and a little more wrinkly over time because the skin thins out. But also there's a membrane within the eyelid, on the lower eyelids, that holds back what's called orbital fat, which is the fat that is in the eye socket to kind of cushion the eyeball. And over time, that fat will then protrude against that membrane and cause these eyelid bags. Now, in the case of the eyelid bags that I have, what I see myself in a mirror is always going to be, of course, just looking straight ahead, because I can't see myself if I'm looking in some other direction, unless I'm looking at a picture or something like that. But in a normal conversation that you're having with somebody, your eyes are going to move around some, and when they move around, that's when you can see those bulges a little bit better. These three little markings here are the fat pockets, and those are the little areas that bulge out when I move my eye up, and they kind of flatten out a little bit when I look down. This line right here is the groove that people feel like makes them look really tired. That groove is what sometimes people will have filler put in. That filler ends up looking terrible, and the reason is that all you're doing is leaving those bags there, but then making this groove here fuller. So now the whole thing is going to end up being fuller. You also have to do that repeatedly. You have to deal with getting stuck with needles every single time, and there's absolutely no upside to doing it that way. There's really no downside to correcting it, except for the fact that you have to have a procedure and go through that with a very short downtime, maybe about a week. The reason you see more of that bulging as you look up is that the contents of the eye socket or the orbit tend to push against those fat bulges and make them protrude against that membrane more when they're in that position. Correcting that is a very simple process by which an incision is made right underneath the eyelashes so it hides really well. As soon as it's healed, you really can't see that it's there. And that membrane can be exposed. And as soon as that membrane is exposed, those fat bulges can actually be kind of teased out of there. If a patient comes to me and doesn't quite have the crepey extra skin that you see in older patients, which is the situation here, I don't have all that extra skin yet. I do have the eyelid bags. Not having that extra skin means I can offer those patients access to those little fat bags from behind the eyelid, way inside there. Usually what I do when somebody comes to me about their eyelid bags is I'll actually show them a little brief video of themselves as they do what I just did, and then they can really appreciate what's happening with those bags and why they're there. Lower blepharoplasty surgery corrects the problem because it's removing that bulging by getting rid of the extra fat that's pushing against that membrane. You get a consistent, permanent result. And it's very smooth without this groove that you see here. And that groove is caused by the shadow that comes from having that bulge. When somebody sees you, they will think that you look like you're well rested. Maybe you don't have allergies anymore. And it's not an obvious surgical look. So people will just say, hey, you look a lot better, you look a lot brighter, you look a lot younger. If you've been noticing upper eyelid skin that's hanging over, if you've been noticing those bags or the wrinkly skin on your lower eyelids, trust me, everybody else notices it too. Upper eyelid and lower eyelid surgery can very comfortably and safely be done in the office with local anesthesia while you're wide awake. The opaque contact lens that I use for patients makes them a lot more comfortable, less anxious. They'll feel like their eyes are closed, and it makes the process a lot easier. It's much more economical, not having to go to the operating room in a hospital with all the expenses that go with that. Therefore, it's a lot more accessible for people. And will make you look a lot younger, will make you look a lot more rested, and people will think you just look better. They're not going to know that you had surgery at all.